What is sciatica? Can chiropractors take care of sciatica? Can they help? What can I do at home to feel better if I have pain down my leg? We're gonna give you some tips. We're gonna go over what sciatica is. Yes, chiropractors can help with sciatica, but first you need to make sure that it is sciatica. There's a lot of things that can cause pain down the leg. There's a lot of things that can cause pain in the low back that travels down the leg, from herniated discs that might or might not be affecting your sciatic nerve, to facet irritations or even piriformis syndrome. So before you start guessing whether or not it is sciatica, one of the recommendations is always to differentiate from some of the other issues. Tumors, infections might all cause some of these, including pregnancy. Pregnancy is a very common cause for sciatica. But first, sciatica is an irritation of the biggest peripheral nerve of the body, meaning not a nerve that's part of your spine, but one of the nerves outside of the spine. It is a bundling of some of the nerves that exit that low back. So oftentimes when we have a herniation, a bulged disc, or trauma to the low back, we can get an irritation of the sciatic nerve. Sciatica typically goes past the hamstrings and the knee and goes into the calf and the foot. So that's one of the easier ways to differentiate it. If it's in the back of the leg and it goes past the knee, chances are it is sciatica. Although ruling out some other factors is important. In our office, we always make a complete evaluation. We might need to take x-rays to make sure that there's not other factors that might complicate the situation. And then once we get everything quelled down, we do the therapies, the adjustments to open up the nerve and reduce the inflammation, everything, we're gonna recommend strengthening of the area. Oftentimes, sciatica is caused by dysfunction in the hips, in the glutes, in the core, and in the lower part of the body and extremities. So let's address that as we get out of the symptoms. So if you're at home and you're trying to make this go away without committing to treatment or anything like that, I would recommend you look into icing the low back and reducing some of that inflammation. Also recommend you stay away from sitting for too long and any movements that aggravate this issue. And then you give it about a week to the piriformis stretches. And as things start getting better with the icing and the piriformis stretch, then I would recommend you start what are called dead bug exercises and bird dog exercises to bring more balance and stability to that lower back. In some cases, a little more strengthening that's catered to your condition might be necessary. But for now, this is a great place to start. Read our blog post, get more informed about what sciatica is, understand a little bit more of some of the exercises and the triggers that bring this about. If you're a pregnant mama, in all cases, we see a lot of this, feel free to come in. We'll be glad to check out your hips and pelvis and make sure that we relieve some of that tension that leads to that sciatic radiculopathy that's typically gone after you've given birth. 561-533-3884 is our phone number. MyMidtownClinic.com is our website, and you can even book an appointment there. We accept cash patients. We also take most major insurances. So give us a call, 561-533-3884. I'm Dr. Francisco Colón. I'm one of the founders and I'm one of the doctors here at Midtown Clinic of Chiropractic, West Palm Beach. Also check out our Lake Worth location. Till next time.